Jonas at Whole Body Chiro here. Today I would like to run through what to do from home when you're in that really acute stage of lower back pain. So I'm talking about that stage when you're so acute in the back that you can hardly do any movements whatsoever. You're just really guarded, and almost regardless of what movement you're trying to do, it's going to hurt you and aggravate your back. You might also be pushed into an antalgic posture where you sort of just your shoulders just shift onto the side like this, and you feel like you can't sort of get back up to standing straight again. It's also quite often that you get pain shooting down your legs, referring down towards the foot, but actually coming from the back. And sometimes certain movements aggravate it even more and shooting pain down your leg. And if you feel your back, you might feel really hot, a bit fluffy, swollen, and basically all these things indicating that your back is stuck in a holding pattern where it's really inflamed, and we need to break this pattern. So the first thing that I want you to do is to head out for frequent walks throughout the day. In the beginning, you just sort of might even need something to get up to standing and just very gently rock from side to side and gently start to move forward. As you're starting to loosen up, you're going to find it easier and easier to move until you eventually can more or less walk normally for 1 to 2 minutes at a time. So just do this super frequent throughout the day. Once you get up to 5-10 minutes walks, try to get in at least 5 of those throughout the day. And that's going to help to sort of bring fresh blood into the area and this stagnant pond of inflammation that you have in the back. This movement is going to be like fresh, turbulent water getting in and sort of diluting that inflammation. Other things you can do to calm the inflammation down is get an ice pack, pop it onto your back with a towel, something like that in between, and that ice will help to calm it down as well. You probably need to hold it there for about 20 minutes at a time, and try to do that 3 to 5 times throughout the day as well to help to calm the inflammation down. Another important thing is to not lie down flat on your back for prolonged periods of time, particularly if you aggravated a disc, because when you take pressure off that disc, it's going to start to swell and swell and swell, and when you're trying to get back up to standing, it's going to be really, really tender when you're squashing that swollen disc down. It might actually cause a disc protrusion and put pressure on the nerves. And talking about nerves, if you have that nerve pain shooting down your leg, it's a home exercise you can do to try to help that condition. It's called the Mckenzie Protocol. The first stage of that is getting onto your stomach with your hands up, supporting your head like this. If you're really acute and have been in that antalgic posture where it's hard to straighten out, just even getting into this position is going to be hard enough for you. And just try to stay here for up to 5 minutes. If throughout this period you have experienced pain before down in your leg and foot, and that pain starting to creep up and it's not quite as prominent in the foot and lower part of the leg anymore, and you just sort of feel it in your lower back a bit stronger, that's an indication that this exercise is actually helping you, and you should keep doing it frequent throughout the day, at least 5 times a day or 5 minutes of lying like this. Once you get past this stage and want to be a bit more aggressive with this exercise, you can move up onto your elbows and just look forward like this with your shin tucked in. Once again, hold that for 5 to 10 minutes, 5 times a day. So in essence, we try to break that holding pattern, get some movement into your back, and don't have that prolonged periods of bed rest and lack of movement that just make this condition worse.